What's up, rookies? Welcome to another snippet on what pharmacists do. Here we talk about what pharmacists do and explore inspiring pharmacy career paths. Today, we're going to be talking about pharmacy interviews. They're right around the corner, pharmacy residency interviews. And to do that, I am beyond honored and excited to have with me Dr. Daniel Ford. Dr. Ford is the clinical pharmacy manager at NorthBay Healthcare right here in the Bay Area, and also the pharmacy residency director for NorthBay. I am so excited to have you on, Dr. Ford. Thank you so much for coming on.
Thank you, Dr. Wabo.
I have known you for 8 years now, and it started when I was a pharmacy student on rotation at NorthBay, and I couldn't think of anyone better than you to come on and talk to us about how to ace those pharmacy residency interviews. But can we first start by you telling us about yourself? Why did you choose pharmacy, and what was your journey from making that decision on to where you are today?
Absolutely. Happy to discuss it. And I'll try and give you the short version because I do have, as you remember, a tendency to ramble. And I don't think anyone's going to watch your video for 5 hours. So
okay, thank you.
They could binge watch. I don't know, maybe.
Maybe.
I'm Dan. I'm a person too. I'm a pharmacist, but also a person. So at NorthBay, we've always gone by first names.
Got you.
So,
okay.
So I'm Dan. My going into pharmacy was a slightly different path than some, but also probably a common story where I was initially thinking of going into medicine and had kind of some reality checks and some epiphanies and some light bulbs. Some were smashed, some kept going, and realized that I needed to make a pivot and that I needed to find a better option. I was at UC San Diego for undergrad, and they happened to be opening a pharmacy school. And I was fortunate enough to be able to sneak in and talk to some of their deans that were previously UCSF preceptors and professors. And one of them, at that point, I'd always thought of pharmacy as the people at Long's Drugs, which is now known like everything at CVS, that would sit behind the counter, kind of dressed like this, but with like a short white coat and frantically doing things and avoiding making eye contact. And I always kind of had a weird perspective of pharmacists, but the dean at the time, Dr. Maniguera, was the director of the Poison Control Center. So he had a bunch of amazing stories and really kind of introduced me to clinical pharmacy. So they were opening the school the year I graduated, and I applied and I got in, and I figured, well, they were opening it for me, so I might as well go. Otherwise, that would be rude. And so there I was. I did work as an intern in some retail settings. I did work in a hospital at the VA down in San Diego, which was super cool. And really, retail didn't really feel right for me. I do kind of have a foggy memory of a customer throwing a banana at me, and I thought that this isn't why I'm getting a doctorate. But so clinical really called to me. The hospital really called to me. I love the excitement of it. I liked the creativity of it, the having to think on your toes, the everything about the clinical, the interaction with the nurses, with the physicians. And so that's the path I took as a student on rotation. My second rotation was in the surgical trauma intensive care unit, and I loved every minute of it. I would be there for 12 hours a day or more. Get there at 4:30 in the morning, round with the trauma team, round with the critical care team, go to codes, go to traumas, save lives, be a hero, just immersed in it, loving every minute of it. So I knew not just clinical, it was going to be critical care. So I did a PGY1 residency at UCSF. It was phenomenal. I did a PGY2 at the University of Pittsburgh in Pennsylvania, which was incredible, and just loved every minute of it. I worked a little bit out in Pennsylvania and started to work at a community hospital, which is a little bit of a different feel than the big tertiary academic centers. And I really liked it. It was a little bit more personal. It let me come down from being Dr. Ford and just being Dan again. And I could still be a clinician. And then I came to NorthBay. I was recruited to start the ICU decentralized program, and I did that. And I did a lot of teaching, working with Toro students and UCSF students and Pacific students. And then eventually I was pulled into management. I like to say kicking and screaming that there's still claw marks in the ICU where they dragged me out, but it was a wonderful opportunity. something a little bit different. Instead of just fixing the one patient in front of me, I was able to
Yeah.
make a bigger impact. I was able to do a lot of
Yeah.
teaching, not just students, but
Mhm.
residents and
Mhm.
nurses
Mhm.
and physicians and my pharmacists, and
Mhm.
make a really big impact. And so my current role as a clinical manager
Yeah.
has been managing our formulary. I work on order sets. I collaborate very closely with physicians and nurses on overcoming barriers and obstacles to care or opportunities to improve. I work
Mhm.
with my team managing their brains instead of just the movement of medications.
Mhm.
I
Mhm.
deal a lot with drug shortages, which is not fun, but it is what it is.
And it's work.
COVID has been an incredible, I'm not going to say journey. It's a roller coaster where the track
Yeah.
sometimes is
Yeah.
missing, but
Yeah.
I've gone through that. And so there's a lot of things that I do. I wear multiple hats. I go to a lot of
Yeah.
committees. I sit on our IRB, our Institutional Review Board, our
Mhm.
P&T
Mhm.
committee, a bunch of other things. And then I'm our residency director, which kind of gets
Yes.
me to what you want to talk about.
Yes. But what a journey though. You kind of you were lucky to figure out what you wanted, what you loved early on in your pharmacy journey, which was clinical pharmacy and then critical care. And then because you were so good at it, you got to drag into being a leader in that arena and teaching students and residents and new practitioners and your staff. So that is an amazing journey. It's one that, and I have to say, I meant to say this in the beginning, as a student, you may not know this, but many students, you're an idol for us. We just loved your personality. We loved your confidence. We loved the way you dressed, all fancy and professional all the time. That's what we talked about. So many of us in the Touro University, California, in the Bay Area pharmacy school community, we all know you and we really aspire to be like you. And I just wanted to thank you for being a mentor and an inspiration for all of us.
Oh, you're gonna make me cry.
It is
But you're
absolutely.
very welcome. I'm glad that's the impression. Sometimes I worry that I just freak people out and
No,
scare them because I'm kind of like
absolutely
overwhelming and
not.
loud.
Absolutely not. So now, pharmacy residency interviews. I was able to survey some pharmacy residency applicants that I know, and they had some suggestions on what questions I should ask you and how you would recommend approaching them. Can we get started with that?
Absolutely.
Okay, question number one was, how can I prepare for the clinical portion of the interview as well as the presentation portion of the interview? Because for pharmacy residency interview, students have to present on a topic that the site chooses. And also there are some clinical pharmacy questions that get asked. And I think that's very intimidating for most students. How do you recommend approaching those?
Yep. So every interview process is a little different.
Yeah.
Our program is a little bit different that way. We actually don't have them do presentations.
Okay. Okay.
There are a lot of programs that do. However, in
Mhm.
some cases, they let you present something that you've already prepared, something that
Mhm.
you possibly did as an APPE student or maybe at school.
Mhm.
Some places will give you a set of options to present on.
Mhm.
The presentations, it's all about just practice. Uh,
Okay.
know your content, make
Mhm.
sure that it's good and in depth. You're talking to clinical specialists, you're talking to clinical pharmacists,
Yeah.
people that may do research,
Yeah.
people that know the drugs, manage the formulary, things like that. And so you need to give more than just what scratching a surface or just maybe I guess the way to think about it is this a student level talk or is this getting up to resident and pharmacist level talks? And so that's
Okay.
what you're going to be aiming for. The trick
Okay.
with that is just practice.
Okay.
The hardest way to practice and the most humbling way, but without a doubt the most effective. And this is a secret, so this is proprietary. No, there's no secret to this.
Get your
But this
pens
is
out, guys.
this is a good one. You guys aren't going to like to hear this though. Get a
Okay.
group of people, get some of your classmates together, figure out your talks or create talks, maybe even just come up with talks that are board prep, right? You got to do it anyway.
Okay.
Come up with a slideshow, find a room where you can give the talks and record them with an audience. That's right. Have everybody in the room, video record it. You can just use a cell phone. It doesn't really matter, right?
Okay.
Record the talk, give your talk, And then this is the tough part. You got to watch your talk with everybody else in the room, and everybody's got to do it. It
Okay.
is very humbling, but what it does is it allows that discussion. It allows you to understand what, like, are you doing too much with your hands? Are you doing, the hand thing? Are
Yeah.
you doing
Yeah.
it to the point where it's distracting? Are you using ums to the point where you didn't actually say anything? Are you having incredible awkward pauses where the audience doesn't know if it's time to take a break yet?
Got you.
You'll be able to feel that, and people will talk about it, but the things that you focus on won't necessarily be what everyone else focuses on. So it's very humbling. I did it as a student. It was the most embarrassing thing ever to sit there and watch myself, from my perspective, just
Yeah.
totally bungled the talk,
Yeah.
but everyone else said, no, you did really well. And so that's the best way to practice that.
Okay.
Now, the
Okay.
clinical quiz, there's nothing
Yeah.
you can do to prepare.
Okay.
It's going to be a surprise, and that's part of it, is to have a surprise. I'm sorry, I'm going to be a little awkward. I'm going to move a little bit because the sun's coming up and it's starting to make my
No
head
worries.
shiny. So the clinical quiz, there's not much you could do to prepare, and that's part of the idea of it. Remember that residency programs are trying to look at you from every perspective they can. So you may end up with a case with something that you're just not that familiar with. It's okay. Go through it. They're looking at other things as well.
Okay.
You can't study everything, but one tip: know everything on your CV, because if they do approach the quiz more from what have you experienced, let's see if you really learned it. Anything on your CV is fair game. So know that stuff well, know your basics, and then, go with the flow and see how it goes and do your best. Give the answers that you can. If you don't know an answer, don't guess and don't make it up. Admit that you don't know it, and maybe don't go down a path. And I think I'm anticipating a question you might ask, because this one comes up every time. What do I do if I don't know an answer?
Yeah, exactly.
Admit that you're not positive on it. You can tell them after you've done that, I'm thinking that it may be something like this or something like that. But what I would do, and this is the trick, tell them what you would do. Where would you go to find the answer? Where would you validate it? How would you do that? What types of references would you use? Who might you call, right? Like, I got a hold of Dan's cell phone. I'm going to text Dan, not in the middle of the interview, but right after. Use your resources. They want to see how that is. And sometimes that's where those questions are aimed at, or those quizzes are aimed at, to see what happens when we stump you. What do you do when you're stumped clinically? Do you fall to pieces and cry? Do you just quit? Or do you keep driving forward? Do you make it up? Do you guess and possibly harm a patient? Or do you approach it in a logical manner? Do you take the time? Do you communicate effectively? And then the final trick with that is you got to get back to them. Say, Dr. Wabo, I'm sorry, I don't know the answer to this. I feel like it might be going down this path. I think there's a guideline out there that I recall by the IDSA that I would probably go take a look at. I would check with my preceptor, but if it's okay with you, I'd like to get back to you on it. And then make sure you get that person's contact info so that you can actually follow through.
And email them back.
Right.
So you got to have some friends to be able to do the practice thing with the video. So while you're in school, you got to network, you got to keep in touch with your classmates and get along, and start planning these things ahead of time, because many people don't have friends that they can sit down with and practice. But I have never heard this advice before, and I have never done it before. I've heard practice in front of the mirror, but not practicing in a group and recording it and watching it over. And it's really true, because sometimes I rewatch some of these videos that I make, and I just hate the way I sound, or I hate why I did that or did this. So it's absolutely true. It's absolutely true. And then, you cannot know everything as far as clinical is concerned, and you just have to know where to look it up, how you would get the answer in the real world setting, and then get back to the person that asked you the question. Absolutely. Thank you so much. Thank you.
And you hit the nail on the head on, you're not going to know everything. And you know what? You're applying for residency. If you knew everything, you wouldn't need to do a residency. So we get that, right?
Absolutely.
We get that. We know you don't know everything. That's the whole point of a residency. So that's not what they're looking for here. A clinical quiz, honestly, I've designed them. I'm aiming for a bell curve. and really a bell curve, those awful things you guys remember from school with the grades. I want to separate out applicants so that I can see where they shine, where they have room for improvement, and then how they handle themselves in there. So we're aware of that. You're not supposed to be perfect. I'm not perfect. Nobody's perfect.
And even now, we don't know everything. And we're still learning every day. And that's part of the reason I also really like this profession, because always something to learn, always something new. Things are changing, and we always, no one knows everything, even to this point, right?
Absolutely.
Okay. Next question, I'm going to read it off. When getting to know a candidate, how do you gauge their personality? I feel that when I prepare interviews, I may come across as rehearsed, but I'm really trying to be conscious of how I look and how I sound. So how do you gauge applicants just by listening to them and watching them? Does that make sense?
It does. And there's a couple perspectives here. So one is from the applicant perspective. And I can speak to this. It was a very long time ago, but I went through residency interviews twice. So I had quite a bit of experience with it. And it really boils back to the same thing as the presentation. It's all about practice. Anticipate the questions, right? You know, some of the obvious ones that are going to happen. Think of some of the weird ones, you know, like there's some programs that do those goofy questions of like, if you had any superpower, what would it be and why? And like,
if you could be a candy, which one would you be?
Right. Like the kooky weird stuff. Be ready for those, because those are lobs. Those are the easy questions, right? Because there's no right answer. You can make stuff up. They're not going to know, as long as it sounds good and it's engaging. And that's really what you want, is you want to get the connection. What we're trying to find is who you actually are, because residency is all about the match. It's about the fit. We're not looking for the smartest person. We're not looking for the person that was president of everything. We're looking for the right fit. And they may be the president. They may be the smartest. You never know. And I'll tell you honestly, for NorthBay, at least, it's different every year. We've had a huge variety of applicants, and they've all brought something unique to the program and to our department. So we really want to get to know you. So that you shouldn't have to practice. That's just a matter of being in control, being prepared for the interview, you know, get there early, know your route, know where you're going to park, plan ahead, get there early, maybe scope it out the day before, you know, do some weird stalker stuff. I mean, not really weird stalker stuff, but, you know, like know where you're going, prepare for it, anticipate traffic, be ready, get good night's sleep, have enough coffee in the morning, but not too much coffee in the morning.
Not too much coffee, gets you jittery.
Right. Be ready for it and be yourself, right? We're not expecting you to be perfect. Nobody's perfect. I don't do perfect interviews still. So we want to see who you really are. We want to see if you're shy. There's some programs that's their fit and that's their thing and that's what they're looking for. If you're loud and obnoxious like me, maybe you're a good fit for NorthBay, or maybe we can't have two Dans at the same time. It's just too much. So you never know. So just be yourself. You should practice and rehearse, but you don't want to have a script. I don't want to see someone with note cards reading things off to me. I want to hear your thoughts, your opinions. I want to hear how you deal with your count. I want to hear how you deal with pauses. I want to see your smile. I want to see you laugh. I personally practice with humor all the time in when I work in the ICU, when I'm managing, when I'm in meetings to an extent. I think humor helps. It makes people relax a little bit. It helps with honesty. It helps kind of bring out, you know, the best in people. So if that's your thing, if it's not, don't do it. Poorly delivered jokes doesn't help in an interview, but, you know, figure your thing. I've seen so many approaches. Some people come with their hearts and their compassion and showing their passion of what they do. That always works well. Some people come in ready to do cartwheels and entertain, don't actually do cartwheels, but like, you know what I mean? Some people are serious and they're like, I'm driven and I'm to the point and I'm exacting and I am detail oriented. And that's what you want in a pharmacist. There's a million ways to do this. And all of them can be very successful.
Yeah, absolutely. Thank you. The next question is, how much do grades impact your evaluation of a candidate?
This is always a tough question. And I love discussing this to first year and second year students. And I hate having to discuss it to my fourth year or last year students, because grades do matter. And those second year students can change things. It's very hard once you've already graduated to
True,
change that.
true.
So I'll tell you our approach. Every program is a little bit different.
Mhm,
Overall, though, grades are one small aspect of the assessment.
mhm.
What many programs do, and I'm going to take a quick pause because my laptop just decided,
Sure, sure. Is your battery dying?
no, my battery's not dying. I have it plugged in, but periodically it decides that I'm not moving enough and doing things, so it tries to go to sleep, takes naps.
Okay, got you. Okay.
Okay, so we're getting back to the question of grades.
Grades, grades.
They do matter, but they don't matter as much as I think everyone thinks. So for an applicant that's still in school, the biggest risk to a residency program is that you're not going to pass your board exams. And so that's what North Bay has historically used grades for, and many programs do. They choose a threshold and they say anything below this is potentially a risk that you're not going to pass your board exams. Therefore, there's a risk that we'll lose you as a resident. So that's all it really is.
Okay.
That being said, I have interviewed applicants that had grade GPAs below what our threshold was, but they ended up explaining it. They, in their letter of intent, maybe described a traumatic family event that happened that explains why their grades slipped. And they flat out called it. They said, look at the first semester of my P2 year and you're going to see a slip, but I want you to look at the third year and see how I've recovered and I've learned from it and grown. I'm good on that. I got a letter from someone's academic advisor that was helping them through. This was like a second profession. And so they had to kind of get back into student study mode, and they helped them through it and they explained all of it, and it worked. For those that have already graduated and are licensed, in many cases, grades really won't impact at all because you've already done the thing that we were worried about, right? So if you're already licensed, it really shouldn't matter as much.
Yeah. So you do get residency applicants that are already licensed.
Oh yeah. At least a couple every year. And they make phenomenal residents. Not necessarily saying it's better to do that or worse, but it happens. And life happens. Sometimes they apply and they just don't get the right fit or the right programs, or something happens and they can't interview and they don't match the first time around. The applicants that go back and work on some of their weak points in their application and then get licensed sometimes come back as a much stronger applicant and are very attractive. I'll tell you, as a residency director, having had residents that were already licensed several times in the last couple of years, it takes a huge pressure off my shoulders in that I don't have to be nervous in August, September, and October of whether or not my residents are going to get licensed, because some of these exams can be unpredictable. The CPJE in particular is very unpredictable. So there's some value in that. It's okay.
Okay. That was an aha moment for me with the grades and the board exams, because many students look at grades as my grades have to be good for me to even get an interview, but really there's more to it. There's, as a resident, you do have to be a pharmacist, so you do have to pass your board exam and not set the whole program behind if you don't. And also looking at the candidate as, if your grades weren't good during this season, what was the reason? Because I really like that, because a lot of mentors and professors in pharmacy school have done that for me, have given me a second chance, because there were really some unpredictable circumstances going on around why I wasn't performing well. So it really warmed my heart that even in residency, you take that approach, and it's because we're all human, and you look at applicants as humans. You gave all those examples of the shy but goal-driven candidate. You've given the example of the cartwheeler. We all have different personalities, and you just have to bring who you are, right? And if you're a good fit for the program, you're a good fit for the program. If you're not, you probably be a good fit for another program, because it's about matching. Absolutely. Okay, one last question. I have a ton, but let's just do one more. This one wants to know, what are some questions applicants should ask after or during an interview?
I'm going to make this quick and short because I know that I talk a lot.
I like it. I like when you talk a lot.
So there's a lot of good questions. There's a lot of common questions. And it's not really worth getting into all of them, but
Okay.
I'll tell you that asking questions about the program are always
Okay.
good, about the
Okay.
hospital.
Okay.
Asking questions about things that should be very obvious and
Mhm.
easily found, right? So like um, asking how many beds the hospital has. You can
That's
look that up.
online.
Yeah,
Yeah.
do your research.
Yeah.
Asking pointed questions about what the program has done to improve.
Mhm.
Have they taken resident or preceptor feedback and made changes to the program? How did it work out? Those are good questions.
Okay.
Those put me on the spot and
Yeah.
reminds me, and I should remind everyone, these
Mhm.
interviews are not just us interviewing you. You are also interviewing us. The
Yes.
interrogation lamp is not
Yeah.
just on you, it's on both of us.
Mhm.
So I love those questions.
Yeah.
Ones that you might want to avoid are salary. So how
Okay.
much am I going to make?
Okay.
Residency is not about making money.
It's
Okay.
not. It's
You
about
will
learning.
make money. You get
Mhm.
paid a lot more than as a student, but
Mhm.
that's not really the point of it. But
Okay.
asking the residents those questions is a great idea, really to get more of a pulse of, can I afford to live in the area? Can I make ends meet during the program? That can be important.
Okay. Okay. Thank you. Thank you. Thanks, Dan. Thank you. I was going to say Dr. Ford again. Oh my gosh. Okay. Dan, last question today. Oh, not a question, but in general now, what advice do you have for pharmacy students who are thinking about doing a residency, for pharmacy students who are applying for residency right now? What advice do you have for them in terms of preparing and doing well on the application and during the interview?
Just that there's so many things that I can say here, but I want to step back and give a general piece of advice. And this applies to people applying to pharmacy school, just interviewing for jobs, already graduated, applies to everybody. Find a job that you love and take that the career path and the training needs to set yourself up for success. So if that means doing a residency, invest in it, because finding a job that you love is so important in life.
Yeah.
We spend more time sleeping and working than anything else.
Yeah. Yeah.
Bridget, you
Yeah.
probably remember me telling you this about 8 years
I
ago, because
remember.
this is a
I remember.
common one. So
I
we
remember.
spend more time in our life working and sleeping than almost anything else.
Yeah.
So
Yeah.
always get a really good, comfortable mattress and invest in finding a job and a career that you love. Because if you wake up every Monday morning dreading going to work and you're miserable all day, no matter how much they pay you, you're not going to be happy.
Yeah.
And if you can find some joy and happiness at work, it's going to follow you home. And that's what you want to follow you home, to make the rest of your life wonderful and happy, and continue and not burn out, and just be happy. That's my advice. I try and practice it. I'm trying to live it. And I try to make pauses and think about that and reflect on it. And I encourage all my students, my pharmacists, my technicians, everyone I interact with to consider that.
Yeah. Wow, that's a really good one. Find a job you love and do what it takes to be qualified for it and to find it, right? Because many of us just trying to find a job because we graduated and we need to pay the bills and we just need a job. But I think it's worth to start thinking about it way when you're still thinking about pharmacy school, when you're a first-year student. Find out what you are interested in, what you love, and start doing what it takes, networking with the right people, doing the right rotations, doing the right internships, and getting yourself ready so that when you graduate, you're able to get the job that you really love. Absolutely. Well, that is all the questions I had for you today. This concludes our chat together. I am again very thankful that you came on to share all these amazing pearls with us. And if anyone has a question for you, I think it'll be okay with you if I give them your email, right? So guys, if you have a question for Dr. Ford, please let me know right here, either on Instagram where you're listening, or YouTube or LinkedIn. Send me a message and I will forward your question to Dr. Ford. Until the next interview, stay blessed. Thank you. Bye-bye.